One of the things that really strikes me is that moment when I have to say to them, there's nothing that I can do to save your foot. And I have to start going down the road of explaining to them the risks and the plan for amputation. One of the real benefits that I think will come out of this project and this vision of getting these cameras out into these communities so that patients can really get their wounds recorded accurately and we can track the wound progress is that we're going to be able to really reduce that timeline between the moment they present and the moments that they get care. We're also going to be reducing the unnecessary travel, that separation from community and family, so that patients, when they do come to Perth for that specialist care which cannot be delivered locally, are coming for a specific reason, not this open-ended journey to Perth which can be so distressing for them. And this is something that we're starting to see in terms of progress. I remember a particular patient who needed to come to Perth, and we were able to organise pick up at the airport. He went to have some imaging and then came to the hospital, and we already knew what we needed to do for him by the time he arrived in hospital. So his length of stay in the hospital was actually a couple of days, whereas before it may have been a couple of weeks whilst we were getting all these things sorted out. So it gives us this real opportunity to coordinate care, streamline it, make the patient journey less stressful for the patient as possible, so that when they look at their reflect on their healthcare, they realise that actually they've had a good experience, and that's what matters, because actually at the end of the day we're there for the patients and the people of the communities that we serve.